Hi, my name is Courtney McNeely, and this is my persuasive speech. Living life knowing you're essentially a ticking time bomb takes both a physical and emotional toll on both patients and their families. The option of physician-assisted suicide could give patients back the control of their own lives rather than leaving their fate up to a terminal illness. Physician-assisted suicide is a voluntary death of a terminally ill patient using a barbiturate prescribed by an educated physician. As an aspiring doctor, this controversial topic has interested me over the years, resulting in me doing significant amount of research. Physician-assisted suicide should be legalized throughout the entire United States. First, I will argue that patients have the fundamental right to choose the manner in which they die. Next, I will argue that the limitations set in the legalized states right now are too strict. Lastly, I will argue that the legalization of this practice can help more than just the patient through organ donation. Terminally ill patients have the fundamental right to choose the manner in which they die. This should include the choice of physician-assisted suicide. According to CNN.com, accessed on July 28, 2020, there are many countries and some states that have already legalized the practice. These states include Colorado, Hawaii, Maine, New Jersey, DC, Oregon, Vermont, and Washington. Some of the countries that have legalized this practice are the Netherlands, Switzerland, and Germany. Although it is legal now, it wasn't an easy process. These places had to go through many months of research, as well as voting from local citizens and long discussions between lawmakers in order to not only decide if they should legalize the practice, but what type of limitations would be set. Giving this option also allows for an ethical and safe death for the patients. Rather than risking the chance of them killing themselves by overdose or a gun-related incident, giving them the option to be killed in a safe environment with doctors and a medication which has been studied is much safer. Now that we have talked about the rights of the patients, let's talk about the limitations. Physician-assisted suicide has been legalized in some states, but the limitations set are too strict. According to an article in the journal The Family Court Review, published in 2017, the age limit for the option of physician-assisted suicide to even be brought up to terminally ill patients is 18 years old, and this is only in places where the practice is legalized already. Many people believe that the age limit of 18 should be lowered for minors that are competent and aware of the circumstances. The author Chikara uses an example of a 16-year-old girl suffering from a malignant brain tumor to explain this. Sarah was told that she had 3 months to live, and that as the months went on, her quality of life would quickly decrease. She would eventually lose her ability to speak, move, and would be in constant pain. If the age had been lowered to include competent minors that were going to suffer in the months leading up to an inevitable death, Sarah wouldn't have had to suffer the way she did. According to HuffPost.com, accessed on July 25, 2020, the procedure for administering a barbiturate to kill a patient is also very strict. The author writes, under the law, life-ending medication cannot be prescribed unless the patient has no more than 6 months to live, as determined by 3 different doctors. The patient must be mentally competent and must submit both oral and written requests to his or her attending physician at least 15 days apart. The patient must also be physically able to self-administer the drug. Although it is important to have rules defining a terminally ill disease and be sure the patient is serious and understands the circumstances, it may be difficult to find multiple doctors. Because this topic is so controversial, there are many physicians that don't believe in the practice, making it difficult for patients to find help. Now that we have went over the limitations, let's talk about how the practice could help others through organ donation. The legalization of physician-assisted suicide can help people other than the patient through organ donation. According to an article in Transplant International, published in 2008, the double process of physician-assisted suicide and organ donation can be beneficial to multiple people. In the journal article, the author talked about a Belgian woman in her 40s that suffered a terminal disease of her brainstem. She had been suffering for months and could no longer breathe on her own. Rather than continuing to suffer, she was able to participate in physician-assisted suicide. Since she was also an organ donor, she was able to donate both kidneys and her liver and save 3 lives. Although there are many terminal illnesses, like a malignant cancer, that spreads throughout the entire body and ruins all organs, there are also many terminal diseases that don't affect some vital parts of the body that can then be used to save others. In conclusion, physician-assisted suicide should be legalized as a small alternative for terminally ill patients. Today we looked at how the choice of physician-assisted suicide is a fundamental right, how the limitations should not be as strict, and and how this practice can act as a benefit by organ donation. Terminally ill patients hold a fundamental right to end their lives safely when they are ready in order to stop their constant suffering. The limitations that are set in place already in states in which the practice is legalized should be looked over in each state and for each individual patient's case. Lastly, the double process of physician-assisted suicide and organ donation could stop the suffering of terminal patients while helping those that have a chance to live. Going back to the introduction, the legalization of physician-assisted suicide gives patients back the choice of how their life ends, rather than leaving the timing up to a terminal illness.